Hi, my name is Mary Cruz, and today I'm going to be talking about pelvic inflammatory disease. Now, what is PID? PID is a common but very serious reproductive health disorder that occurs in the female upper genital tract, and the structure is near that genital tract. Now, the upper genital tract includes the vulva, the vagina, the cervix, the fallopian tubes, the uterus, and the ovaries. It's seen in a lot of young adolescents and young women in the United States, mostly non-white females in the United States. Now, complications of this disease include fibrosis, scarring, loss of tubal function, ectopic pregnancy, pelvic abscess, infertility, chronic abdominal pain, pelvic adhesions, and depression. Sometimes women don't have to be hospitalized for this disease just because they don't show symptoms or their symptoms are less severe than those with much more severe symptoms. However, it is really important for the women to have follow-up appointments with her doctor just to make sure that her disease has improved and has gone away from time and from antibiotics. Now, some data about PID. It's usually caused by an untreated infection of chlamydia and gonorrhea because of an ascending polymicrobial infection. The risks of pelvic inflammatory disease are being an adolescent and young adult, especially if they are inexperienced of having sexual intercourse. They may act like they know what they are doing, but not having the knowledge may cause these young women to have some serious trouble for the future, such as PID or some other sexual transmitted infections. Having multiple sex partners and not using barrier contraceptives puts females at risk for PID. Alcohol, drugs, and smoking also contribute to this reproductive disease, but those things like alcohol, drugs, and smoking should be avoided anyway, no matter what health concern that you have, not just for an STD or PID in this case. It is also important as a nurse to assess female patients about their history of pelvic inflammatory disease, because the number one thing of treating this disease is to make sure that the female has not had reoccurrence with this disease. It is also important for any other type of sexually transmitted infections to be assessed, other contraceptive uses just besides condoms, but also if they're taking any pills, if they have any patches or an IUD. And if they douche their genital area, since this type of hygienic technique is not really hygienic in a sense, and it's not beneficial in any way because it could disrupt the normal flora of the vagina, and the pH could be all sorts of messed up just because you are treating it like how it's not supposed to be treated. And also, as said earlier, having a history of PID can also put a female at risk because of the reoccurrence of that reproductive disease. Now, some clinical manifestations. So PID has hallmark signs of abdominal vaginal discharge that can be foul smelling and have a really bad odor to it, and also a temperature that is greater than 101 degrees Fahrenheit. It's also important to ask about or observe for prolonged or increased menstrual bleeding, dysmenorrhea, which is pain during a woman's period, which is sometimes not due to underlying diseases, just like menstrual cramps, just because of your flow. Dysuria, which is pain during urination, acute lower abdominal pain, painful sexual intercourse with your partner, nausea, and vomiting. And these are all clinical manifestations that should be accounted during their hospital stay if they are staying at the hospital. Now, for laboratory testing. So upon learning the clinical signs and symptoms of pelvic inflammatory disease, laboratory tests should include erythrocyte sedimentation rate to check for inflammatory processes, and these would be elevated in PID, as well as a C-reactive protein level, which would be also elevated. Checking for white blood cells on a saline vaginal smear, since that could be abnormal. It is also important to check their temperature daily or every shift or whenever it's needed during vital sign checks, just to make sure it's not going up over 101 degrees, because that could be really serious. And although the laboratory test for this disease is not all specific, it's still important to perform them to at least get a baseline of their disease and to figure out the results and what is truly causing the patient's problem and condition. Other tests to diagnose pelvic inflammatory disease are a pelvic exam to check the pelvic organs, a cervical culture to check the cervix for any infections, a urine test to check for blood, cancer, and other diseases. And additionally, it is also crucial to check for history of chlamydia and gonorrhea because these could also cause pelvic inflammatory disease if they are left untreated. And as for interventions, as a nurse, it's important to keep the patient comfortable and obviously painless during their stay, especially if they have a condition such as an STD, which could be very painful for them. And as with PID, it is good to maintain rest and hydration and just a calm and peaceful environment, and not something that's just going to stress them out just because they are already at the hospital and it's stressful enough for them. Now for hydration, these would come via IV fluids if it's truly necessary, and to administer analgesics to relieve any pain and their fever, which is over 101 degrees. Since the patient may have a fever, they may also experience fatigue, weakness, malaise, and chills. And it's important to let the patient know to call their nurse with their call light so the nurse could help them ambulate to the bathroom or just to get them anything that they want, like water, fluids. It's really important for them to call the nurse just because since they are weak and since they are fatigued, this could pose a potential threat of them being a fall risk just by going to the bathroom that's 3 feet away. And education on how to prevent PID and any other STI, just such as proper hygiene, using condoms, limiting sexual partners, and getting tested regularly are important not just for pelvic inflammatory disease, but also for a sexually transmitted infection if it is suspected. And if needed, a referral for sexual counseling could be ideal, but this may be a thing that a patient needs to be ready for, and it can't just be something that they jump the gun about. It's definitely a referral to help them with their readiness and help them to learn and to talk about their feelings about their disease. Putting the female patient in semi-Fowler's position could also help any vaginal discharge flow through, since they do have that hallmark sign of having vaginal discharge abnormally. And a woman may be uncomfortable talking about sexual encounters with her nurse or really anybody else. So as a nurse, the topic should be opened up kindly and in a comfortable environment, just so they themselves are not uncomfortable and that they are able to talk freely with the nurse and to speak about their personal sexual life. That is not easy for anyone. And the conversation should be opened up when the patient seems ready to talk about it, not when they're in distress or when they're watching TV or anything like that. It's good to educate her that her partner or partners should also get tested for any STIs, since men can also be silent carriers of PID, and she may have not gotten it from one of them. Lastly, if they are prescribed antibiotics, it is very, very significant and crucial for them to finish their antibiotics. Some patients may say, "Oh, I'm feeling better," and just stop taking the medication altogether, or accidentally skip a dose or just throw it in the garbage because they don't need it anymore. But in reality, if they do skip the antibiotics, that may recur their PID and worsen their symptoms, or even worse, have resistance to that antibiotic, and that is even harder to treat than the actual condition sometimes. They recommend antibiotic medications by the CDC are ceftriaxone plus doxycycline with or without metronidazole or cefoxitin and probenecid plus doxycycline with or without metronidazole. It is always the nurse's responsibility to provide a free and caring environment to make the patient more comfortable and not stress as much, just because they have all these other things to be stressed about, and this could be the very last thing on their plate while they are hospitalized, if they are hospitalized. And of course, being non-judgmental and talking to your patient like she's a human being and not looking down on her is also a really great and beneficial nursing intervention, just because we want our patients to feel really good about themselves and obviously to keep their hope up during their hospitalization. And since they could become depressed with this condition, it is very important to offer for them to talk to somebody or offer to talk to them as your nurse, and just offer some good interventions such as imagery or music or movies on the TV and stuff like that. And that is pelvic inflammatory disease. Thank you.